I'm going to tell you what took me 4 years of working in India's mental health space to understand that all the conversation around mental health landscape are misleading. And I'm going to do that under 15 minutes. So I want you to stay with me. Hi everyone, I am Shagun Sharma, the founder of Reform for India's Mental Health Advocacy. I work at the intersection of research, policy reform, and community-based interventions to rebuild how India reaches, accesses, and sustains mental health. I want to shift the conversation from self-help slogans to actual systems thinking. And this is the first video in that direction, so stay with me. Because nobody is talking about how misplaced and fragmented our mental health landscape of India has become. We talk about awareness, but most people don't know that nearly 80% of Indians do not receive mental health treatment. And that's not because they don't want it, it's because the systems are not ready to serve them. We have made mental health services visible. We haven't even made it shareable, but what we haven't done is make it equitable or accessible. And in this episode, I'm going to walk you through 5 structural gaps that keep mental health services in India stuck. And these gaps are almost never addressed at scale. And it's not because the data isn't there, it's simply because we are looking in the wrong direction. So let's start with the most common misconception that awareness alone is enough to create the progress. We're having more mental health conversations in the recent years than we've ever had, and that's a very good thing. But my question is that what really happens after the awareness kicks in? Where does the individual who is suffering goes? Here's what the data has to say that according to National Mental Health Survey, only 1 in 10 people with a mental health condition in India receive any formal treatment, and 80% remain untreated, and mostly due to structural barriers like cost, stigma, distance, or lack of services. We tell people to go seek help, but we should know that 75% of India's districts do not even have a single mental health professional, and that's a problem. In fact, most people don't know that India just has 0.75 psychiatrists per 1 lakh people, according to the global median of 9, according to WHO 2020. So while the campaigns are getting louder, the care infrastructure isn't getting deeper, and that's a very dangerous mismatch, and we should work towards this huge service delivery gap. Let's talk about second gap, finances. So mental health is chronically underfunded, and not just globally but especially in India. So India spends less than 1.3% of its total health budget on mental health, and of that over 90% goes to hospitals and care centers, and less than 0.05% goes towards prevention, community care, or mental health promotion. Imagine funding 99% of the fire brigade after the house has already been burned. And this brings me to another gap, which is affordability. So even if you're able to access care, you won't be able to afford it. Because if you talk about urban centers, a single therapy session costs between 1000 to 3500, and for most of the population, which is their weekly or monthly disposable income. So this means that mental health care isn't just geographically inaccessible, it is also economically inaccessible. And let me tell you that affordable healthcare is equitable healthcare. Without pricing structures, insurance coverages, and public services, which brings the cost down, we are leaving quality care as a privilege for the few, which is very unfair. And we need more structural programs and investments to build rural and community programs so that we are considering all parts of the population. Here comes the fourth gap, yet one of the most crucial ones, which is the lack of evidence based approach. So, in India, many mental health programs are rolled out without any rigorous research or monitoring or evaluation, whereas mental health services should be grounded in proven effectiveness through controlled trial outs and culturally and linguistically adapted models which have long-term follow-ups. This is so important, but in India, it's sadly very few initiatives are subjected to this level of scrutiny before scaling up. There's this 2022 review by the Indian Journal of Psychiatry, which found that over 60% of community mental health initiatives in India had no published evaluation data. That means we don't know if they work for whom and in what context, which makes it so hard to refine, replicate, and definitely we cannot justify it to scale it up on a larger level, right? So, if we really want real progress, we have to treat mental health programs as real public health interventions, which are designed like that and which are tested, measured, and they are adaptable. The fifth one, the final one, and the most overlooked one is we don't know what works. Many mental health programs in India often do not have any monitoring or evaluation systems through which we can track what's working and what's not working. For instance, let's take district mental health program, which is largely criticized for lack of real-time data, for inconsistent staffing, and for no outcome measures. And you know what all of this means? This means that even with the well intentioned policies that are existing in the society today, it's so hard to adapt to the needs of the society that they're serving. And without this feedback loop, we won't know what's effective and we won't be able to replicate what's working. And we won't able to let go of what's not working. Here's what I hope you take away from this, that mental health is a personal journey, but it's also public good. And right now, public good is unavailable to most of the public. Awareness is only the step one, but making mental health reachable, affordable, and relevant for the community is the journey that we all need to stay committed to. And let me know what you think in the comments down below. Let me know if you were able to connect the dots. And building better systems start with conversations like these and with the people who care enough. So if you're one of them, hit subscribe, follow along, and see you in the next episode.